Hello, everyone. I hope that you are really good. And as you know, I'm making a whole series of all neurology topics. And this topic is meningitis, and this is a part two of meningitis. The part one is there, and in the part one, more of clinical was there. So, in the part two, I have shoot more about the microbiology part because it's really important to know which organism cause meningitis and how are we going to treat them. So let's see. And I wish that you have watched the first part in order to understand the second part more better. Now this slide is little bit complex, so I'm going to divide. Just calm. And in adults, as I told you, pyogenic, there are three organisms. Okay, first is your Streptococcus pneumoniae. Second is your Haemophilus influenza B, and the third is your meningococcus, or you can say Neisseria meningitis. Okay, so I have divided one, two, and three. So when you are going to study, like for all, if a patient or an adult comes to you, we start with an empirical treatment of vancomycin and ceftriaxone, or you can give any kind of third generation cephalosporins, and we start the treatment if we suspect that a patient is having meningitis. But you are going to give this treatment after you have done the lumbar puncture, because the values might differ. So first we do the lumbar puncture, and then we give an empirical treatment in order to relieve the patient, and then we are going to take this all the samples to microbiology lab and know what is the exact cause, and accordingly, after we know that which is the organism causing it, accordingly, so we are going to give the patient treatment. Now, for pneumococcus, that is your Streptococcus pneumoniae. What like these are all case scenarios. You understand it this way because the question they ask are can be like interlinked to microbiology as well. So they start with a clinical scenario telling you about all the clinical features of meningitis, and then they may try to tell you that which is the organism which might be causing it or anything like that. So for the organism, we have to be very much specific. We need to know certain features which are going to indicate that, oh, this is the organism, or this is the one which is which they are talking about. Okay, so for Streptococcus pneumoniae, it is a little bit hard to learn all these things. I do understand, but like these keywords can just directly give you a instant answer, so please do try to learn as much as possible. So for Streptococcus pneumoniae, we have a blood agar, which is going to be alpha hemolysis. You can see we have alpha hemolysis, we have beta hemolysis, but in this you are going to see alpha hemolysis. The tests like optogen sensitive, bile solubility, inulin fermentation, these all are positive for Streptococcus pneumoniae. So we have two, right? Streptococcus pneumoniae and Streptococcus viridans. Okay. So for Streptococcus pneumoniae, these all are positive, and Streptococcus viridans is very, very resistant to all this test. So you just remember it this way. Fine. And both are alpha hemolysis. Both are going to show alpha hemolysis. Fine. Next, for pneumococcus, we have a pneumococcal vaccine. And wait, see, they can give you one more hint that the organism is having lens shaped, or it has like the picture which I have shown. This kind of picture they can give you, and they can tell you that it is like this, something like this. And this is going to show you Quilling reaction, and Quilling reaction is because as this organism has a capsule, and you can see that it will be like filled with some fluid, and the whole swelled, and that's why it's called Quilling. You can say remember it as swelling reaction or swelling reaction, something like that. Okay, then we have pneumococcal conjugated vaccines. And wait, you also have one more thing, that is your Drotsman colony or carom coin colonies. And I forgot to add the picture to it, but the carom coin colonies and Drotsman colonies will be like this: that if this is a circle, there will be a small circle inside it, and you can completely appreciate the two circles, and that's why it looks like a carom coins that we have. So this can also be one of the hints they give you. Also, this is the most common cause of community acquired pneumonia. Okay, now the types of vaccine the pneumococcus have. Okay, the one is your conjugated one, and the other one is polysaccharide vaccine. Okay, so the polysaccharide vaccine is the one which we call at 23 pneumococcal, and that is the one which you are not going to give below 2 years. Okay, but the conjugated one, which is PCV 13, can be given to less than 2 years of age, and according to your NIS schedule, we give PCVs to I think 6 weeks, 14 weeks, and the PCV booster is going to be given late. Now, there were certain names given to this, like pneumovax is the one which is given to polysaccharide vaccine, and Prevnar is the one which is given to the conjugated vaccine. The names, okay. Now, Haemophilus influenza B. Now, Haemophilus influenza B, also like remember one thing in pneumococcus, if you get the positive, then you have to give beta lactams. For Haemophilus influenza B, these the most common thing which you can see in this picture is they are going to be cocci as well as bacilli. So one organism which is going to be cocci plus bacilli causing meningitis in adults will be Haemophilus influenza B. In Haemophilus influenza B, Thayer Martin medium will be one which can be given to you as one of the keywords, which will be positive, and maltose fermentation will be positive for this. You can remember everything as Thier Martin medium is positive, maltose fermentation is positive for this. Also, Haemophilus influenza B is having two types of vaccine, that is your polysaccharide vaccine and your conjugated vaccine. Now, whenever you are going to study community medicine, in community medicine in vaccines part, you will see that there are certain types of vaccines on the basis of how they are being made. So polysaccharide means all the polysaccharides which they use, and conjugated is the one which is conjugation of many things. In meningococcal, that is your Neisseria meningitis. See, uh, what are the keywords that you will find? The blood agar is having satellitism, okay, and also it is going to be lens shaped. It's capsulated. Nasopharyngeal route is the one which they adapt, and glucose and maltose fermentation. Now, if you want to study meningococcal, that is your Neisseria meningitis, you have to compare it with Neisseria gonorrhea. Gonorrhea will be like kidney shaped. It will be just positive for glucose, like all G's will be there. Okay, G, and then above you can see it as a kidney. Okay, G, that is glucose fermentation, is going to be positive, and G is again for your genital, like these are commensals for your genital region, and Neisseria meningitis is commensal for your nasopharynx. Commensal means that these are common organisms which are usually found in these areas. Okay. Now, in Neisseria meningitis, you can also have one more specific feature, that is type 4 type of pili, that is they are going to be motile. Usually pili are not motile, but in Neisseria meningitis it is motile. Okay. After, if you are going to have 100% diagnosis that it is Neisseria meningitis, we usually go with the treatment of IV ceftriaxone, which is going to give you like this is a specific treatment for Neisseria meningitis. Okay. Now, for Neisseria meningitis or meningococcus, we have a vaccine, and that is a capsulated vaccine. As it is a capsulated organism, then it will have a capsulated vaccine and a polysaccharide vaccine. And what happens is it has different strains. So it has A, B, C, Y, and W135 as a strain. So in this vaccine, they have not included B, but all the other strains are there, like A, C, Y, and W135. Okay, so this is what this is how, if there is a going to be any kind of patient, any kind of adult who comes to you with meningitis, and these are the organisms we are going to look for it. Okay. Now we see pyogenic meningitis in neonates. Now, for neonates, most common organism in India will be your E. coli. If you get any kind of question, then you have to mark E. coli. But all over world, what is most common is your group B Streptococcus, that is your Streptococcus agalacti. Now, for all this, also we are going to see every like common features or whatever questions I got, I'll tell you about it. Now, in case of Streptococcus agalacticus, it has long chains. CAMP test is going to be positive. So this is a picture of CAMP test. In CAMP test, what is happening is Streptococcus aureus is in your vertical line, and your Streptococcus agalacticus is a horizontal line. As both are going to be like going to show hemolysis, beta hemolysis, this is also going to show hemolysis, and Streptococcus agalacti is also going to show hemolysis, and that's why we are going to see an arrow like head, which we call it as a positive reaction. But if you do not see an arrowhead, then that means that it is a negative reaction. We also have reverse CAM test, but whenever we have that organism, I'm going to explain you that too. Okay. Now, usually you do not, you are never given the words which I have written here, like hipurate, hydrolysis positive, or bacillus resistant red pigmentation on Islam medium. They may be given, but there are very rare chances that it is given. You can just remember it as hip hip hooray gala camp, and in child you can remember like usually camps and gala are the places where children go. So you can remember it at hippo rate, and gala is for Streptococcus agalacticus, and it is CAM test positive. Okay, now E. coli is going to be most common. It is gram negative bacilli, and for E. coli, usually you are not going to give any, you will not be given any key scenario, because till now, whatever questions I have solved, I didn't find anything like this. They directly ask you what is the most common cause of pyogenic meningitis in neonates. Then you are going to mark E. coli. Okay, now the third organism is your Listeria. Listeria has a one most specific feature, that is it has a differential motility. And differential motility, like for lower degrees, that is your 22 degrees, when it is a little bit cold, it will be having tumbling motility. When it is hot, that is 37, it will be non-motile. It becomes it doesn't want to move at all, and in 37 degrees it becomes non-motile. Okay, now this is a whole like common features, like it will be Anton test positive. It's like A B C D E F G till there. So A is like Anton's test positive, and this is a test in which you are going to insert the organism into eyes of pigs, and you are going to see some reactions, and that's how we diagnose that it is Listeria. Beta hemolysis, it is going to show you beta hemolysis, and contact with contaminated food and cheese, some cold enrichment. Now I'll tell you one question which I solved. It was on cold enrichment, that was increasing growth at 4 degree. So what did they do? They gave me some question, like the refrigerated food was there, and the child eats that refrigerated food, and they gave the some other symptoms on it, and they asked me which kind of organism it will be. So please do remember that if you have some cold refrigerated food, then it can be Listeria, which is causing meningitis. Okay. And okay, not only meningitis, it also causes diarrhea, and your ELISA test will be positive. Females usually pregnancy, and this, if the pregnant female is going to be there, then you can see that the infant can have infection. That, and also I got a question on this palcam agar. So palcam agar is positive for Listeria. What is the treatment for this is your ampicillin and gentamicin. You can remember like A, B, C, D, and you can went to G, right? So letter A and G, that is going to be your treatment for ampicillin and gentamicin. Now, for all this, the empirical treatment is ampicillin and ceftriaxone. But after you, like I told you, like after we get to know which is the organism causing it, we directly give the treatment to the child. Now, this is like I already told you, we are going to differentiate this from bacteria. So, whatever CSF value we study is the one which we are going to differentiate bacteria and TB from. So, bacteria will be having WBCs more than 1000, and TB will be having 10 to 500. Okay. Now, for Mycobacterium TB, whatever case scenario they give will be like either they will be like immunocompromised or HIV positive, something like that, or even they can tell you about that if the patient had a lung infection or something like that, and then you can understand like it can be Mycobacterium TB, because the first organ it affects is your lung, and the second is your lymph nodes. So they can also tell you that the lymph nodes were swollen or something like that. Fine. Now, Mycobacterium TB, Mycobacterium TB is acid fast positive. It is not gram positive. It is weakly gram positive. So that's why we cannot culture it into that medium, gram stain medium. And it is non-filamentous. And whatever tests we do, we have to remember that very carefully. Like we have molecular test, that is your CBNAT. Okay, that is the PCR for it. And we have IGRA test, that is okay. And then we have Mantoux test, we have LJ culture. LJ culture usually takes like 5 to 6 days, and hence it's like more than 6 weeks, so it is not being preferred usually. But you are asked the question of what are the contents of LJ medium, LJ culture, so you can remember it like fresh breakfast. We have hens, eggs, some salt, some asparagine, and malachite green, something like that. And this will be showing you rough, buff, and tough colonies. Now, one more question they do ask you is about your LAM test, which is done in urine if a patient is HIV plus TB positive, and LAM is your lipoarabinomannan test. Okay, so this is going to inhibit the phagolysosomal formation, and hence we are going to identify that it is Mycobacterium TB. This question is asked once through in any of the, I think, PYQs or somewhere, so please do remember it. Now, if there is, this is like a common thing that they will put it in the case scenario, like it is going to be a long history, and then there will be gradual neurological deficits. And in pediatrics, it is associated with hydrocephalus, but till now, I have not seen any question on it. So you can also have the word cobweb appearance. So if they give you cobweb appearance, it is going to be very easy for you to identify that it is definitely Mycobacterium TB. Okay, you can see the picture also here. Okay, you can see in this picture that there is some cobweb appearance, and this can give you a definitive diagnosis of Mycobacterium TB. Okay, and this I'm going to explain you more detail when we are going to do lung, and we are going to study Mycobacterium in more detail. For now, you just have to remember that this there is going to be cobweb appearance. What are the tests that we are going to do if you have meningitis test? Okay, TB meningitis. Okay, uh, what are the parasites which cause meningitis? Meningitis is your PAM, that is primary amoebic meningoencephalitis. But this is like combination of meningitis as well as encephalitis. Encephalitis is infection of your brain parenchyma, and meningitis is meninges. So it is like these organisms cause infection in both the areas. So, PAM is usually from organism Naegleria fowleri, and it is going to transfer via nasal route. And what happens is whenever a person is swimming in a stagnant water, this organism will go from water to your nose, and from nose it is going to travel to your brain. Now, whatever we find in CSF will be like neutrophils will be filled of multilobulated nucleus, and you can see the trophocytes of Naegleria fowleri being floating in the CSF. Now you can just remember This as Naegleria foveri starts with N, and via nasal route, so that is also N, and it is going to affect what? Neutrophils, that is also N. So everything starts with N. N. You might have seen this cycle which I have shown you in microbiology. Cycles in microbiology are really important to understand, because whenever they give question, they may directly give you the image of cycle, and you have to tell which kind of organism it is. Okay, and now we study GAM, and GAM is usually caused by organism like acanthamoeba, and we also have balamuthium like that, and there are this is one more organism which causes GAM. But most commonly, the question they ask is about acanthamoeba. Now, in acanthamoeba, the word acanth means spike-like. Okay, you could have studied in pathology. Acanth. One more word is there which starts with acanth, and these are the cells which are going to have spike-like appearance. Okay, so tropocytes will be having some spike-like appearance, and the cyst will be having an outer brittle wall. So these are the two things, and they may ask you about it. What about other? That is your mottled meningitis, and this is kind of an exception for HSV infection. That is your herpes simplex virus infections. We have HSV1 and HSV2. So this is the only one which causes HS. This is which is caused by HSV2. All the others are caused by HSV1, the brain infections usually. So in mottled meningitis, the CSF is going to be having monocytes, and the monocytes nucleus is going to be clefted like a leg. You can see the picture, the leg appearance. That is what we call as morellid. Now you can, if you want to remember this, MMMM. Okay, mottled meningitis affecting the monocytes. Fine. Now, this is a question for you itself, but I think you will be able to understand like what is the organism I'm going to talk about. So we start with clockwise direction. So you see the immunocompromised tag first. In like whatever scenario they give will be like immunocompromised truck drivers are the most common keyword they give, and AIDS positive. Okay, and the clinical features will be of typical of meningitis like fever, headache, but the one feature which is different will be the photophobia, the presence of photophobia. Okay, next, investigations that we do is NCCT for this, and that is going to show you raised ICP. Now, raised ICP can be seen in all the types of meningitis. In lumbar puncture, you will see CSF, like you will do lumbar puncture, and lumbar puncture, if you do gram staining, everything will be negative. But if you do Indian ink, that is your negative staining, you may see some positive, like the picture which I have shown you. Wait, the picture which I have shown you, the Indian ink nigrosine, that is your negative staining, and these are the capsules. Capsules are going to be unstained, right? So if this is the organism, the center one is the organism, and the beside one is the capsule, and this capsule is going to be not be stained, and that's why you can see the capsule differently. And negative stain, what do you mean by negative stain? It's like you are not staining the organism, but you are staining the background in order to highlight the organism present in it. Okay, now you can see brownish color bird seed or Niger seed agar, because of the enzyme called as phenol oxidase or lacase, which is used in order to see this organism, and this will be some yellowish depositions which will be you will be seeing in it. Now, what does the word mean? Niger means black in general. So you can see the Indian ink is also called as nigrosine, black. Okay. So also this bird seed agar which we are using is black in color, and that's why we call it as a Niger seed agar. Okay, even remembering this phenol oxidase or lacase is also important, because sometimes they do ask question on that too. What is the investigation of choice? Investigation of choice will be like CSF, ELISA for cryptococcal antigen. So answer is revealed that it is Cryptococcal neoformis, which I am talking about. Cryptococcal neoformis do cause meningitis in an immunocompromised patients usually. Okay, so Cryptococcus is going to be excreted in the bird droppings, and whenever bird droppings are going to there, you will inhale by your nose, and it goes to your lungs, and from lungs, from the blood supply, it goes to your brain, and that is where they will form their own house and cause you infection. Okay. Now, this is one of the important points from exam point of view that LFA, that is your lateral flow assay, is more important than latex agglutination test, because it was found that lateral flow assay is giving more better diagnosis than latex agglutination test. So you can do this in your serum, plasma, or CSF. Usually we use CSF. Okay. What is the treatment? Liposomal amphotericin B, which we give IV, and 5-fluorouracil. So you have to remember this as well. Now, for what is the differential diagnosis for this? Differential diagnosis will be a pneumococcus, because, as I told you before, that in cases of adults, the most common organism which is causing meningitis is Streptococcus pneumoniae. And yes, in cases of an immunocompromised, we do have we do they can get pneumococcus, but what are the features of pneumococcus will be the cells will be like this, lancet shaped, it will be having Coulang or swelling reaction, also those Drotman colonies or Karam coin colonies. So these are the way, this is how you are going to differentiate if it is going to be cryptococcal or pneumococcal. They will definitely give you some kind of hint which will tell you that it is going to be pneumococcus. Okay. And also one more point, that pneumococcus is also positive for Indian ink. Now, if they give Indian ink, please do not get confused, because Indian ink is positive for both of them. Because this is also a capsulated organism. It also has a capsule, right? So it can be positive for both. What is, of course, antibiotics will be the treatment for it. Now you can see mucicarmine. See, mucicarmine stain is the one which we are going to use on the brain. And this, in the brain, for doing brain biopsy, what you have to do is the patient has to be dead, then only you can do mucicarmine stain and see in the brain. See, usually this biopsy we are not going to do, and we usually do not diagnose it on that basis. But sometimes if you get any kind of question, you can think about it. So what is the answer for this? This is going to be your cryptococcal meningitis, or you can say cryptococcal neoformis. We have to write cryptococcal neoformis and cryptococcal gatti. Okay. Now next will be okay. This is the final slide of all whole meningitis. What I have. Usually, I have talked about the treatment in all separate ones, and also the empirical treatment which we give. But in this slide, I'm going to tell you if there is a pediatric or a neonate or a small child, what you do is first give IV antibiotics, third generation cephalosporin and vancomycin. See, cephalosporin, third generation cephalosporin is common, which we give in adults as well as in case of pediatrics. Okay, vancomycin is the one which we are adding in case of pediatrics as well. Okay, but meropenem is gonna given if you have allergic to cephalosporin. But usually the question they ask you will be like, what is empirical treatment or generalized treatment? Then you give cephalosporin as an answer. Third generation cephalosporin, ceftriaxone. The second thing is IV steroids, that is dexamethasone. This is to decrease the inflammation and also incidences of sensorineuronal hearing loss. As I told you, in case of neonates and in pediatrics, or in case usually, like what happens is a child will have meningitis, and if it's not treated properly, it may travel to the inner ear and damage the inner ear, because the brain meninges are connected to it, to the inner ear, and hence it can cause sensory neuron hearing loss later in future. Okay, so for that we are going to give dexamethasone, or we do beta as one of the diagnostic test. Now, this special situation is also special, like it's USMLE based, and they do ask you in USMLE, they do ask, but otherwise in Indian exam, I have never seen that they ask you about these special situations. And there is deficiency of T lymphocytes, then it can be Listeria, and we give ampicillin for Listeria. Also, like I can remind you one more thing from here that. Okay. From Listeria that I told you A to G, and we give ampicillin and gentamicin, and ampicillin is a treatment for this. Okay. Now C5 to C8 complements. If there is deficiency of C5 to C8 complementary proteins, then we have Neisseria meningitis. That is your third generation cephalosporin is the one which we give. Now this question is asked because it is not asked on your clinical knowledge. It is mostly asked in your pathology. Sorry, yeah, no, immunology one. So in immunology, we have learned these complementary proteins, right, from C1 to C9. And if there is complementary deficiency of C5 to C8, then we get Neisseria meningitis as an infection, and the treatment for it will be third generation cephalosporin. CSF lesions will be like Streptococcus pneumoniae, and if there is VP shunt, that is your Coney's organism, coagulase negative Staphylococcus aureus, then whatever we do is shunt tapping, and we give antibiotics against Coney's. Okay, so I thank you all for listening to this whole video about meningitis, and I request you all, please do understand that meningitis is really very important topic, and you have to understand it from all the aspects. If there is something which I have not covered, I request you to please comment me on the comment section. And if you have any kind of doubts, any kind of queries about study related, or you want preparation, my suggestions for your preparation, or any kind of question about the topic, then you can please comment it. Also, I always say, please do give me your reviews about how is this integration, like you are liking about this integration or not. If there are some topics like about neurology or any other system which you feel that has to be integrated, please do tell me, and definitely I am going to cover it in my next videos. Thank you so much for watching it.